All right, good morning, everyone. Thank you for joining us today. My name is Tom Florian. I'm with the Iowa Girls High School Athletic Union and would like to kick things off by introducing our executive directors, Jean Berger of the Iowa Girls High School Athletic Union and Tom Keating of the Iowa High School Athletic Association.
Well, good morning, everybody, and thanks for joining us. We know this has come at us all pretty fast, but today we have an opportunity to go over a few things. So the first thing, just an overview for you. We're going to go over the review of the Department of Education and the public health guidance. Then we're going to go over some specific information related to eligibility, our screening and testing protocols, social distancing, practicing games, facilities, and some umpires. At any time, please submit your questions through the question and answer feature. We do have Todd Tharp, Jared Chizik, and Gary Ross on, and they're going to be answering them live to the best of their ability. Once the presentation is over, we will answer questions or give you more information as we see it. We are recording this, so if at any time you want to go back later and review it or share it with someone, we will be providing the link. Okay, so as we get underway, as we know, practice starts June 1st. That's when you begin practice. And we know there are a lot of requirements for signage. So both the Girls Union and the Boys Association have created signage that you can download. Those will be posted on our websites today. We have both color and white background options. I think Tom's going to pull up some of those examples. So there's some playing safe and some hand washing ones those are for players, and then here's your practice guidelines that you can hang and share. Here's your game guidelines. You can see they're both softball and baseball, so they're sport specific for your facilities. What not to do, what to do, and these are all from the Department of Public Health and the Iowa Department of Education. Here's a stop one for your patrons as they enter into the facility. So we've created those. You're more than welcome to log on. We'll have a link and you can download them and print them as much as you want, or you can take the information and create your own signage if you like. Remember, during practices, there are no dugouts. They suggest that you line up your equipment 6 feet apart along a fence. No one allowed at practice. That means no parents sitting there watching. If they come, they need to remain in their cars. They can drop or pick up their kids, but if they stay, please have them stay in their cars. And it's suggested that players utilize their own equipment as much as possible.
Good morning, everybody. This is Tom Keating from the Athletic Association. The next slide that you see talks about social distancing and just, you know, the nature of the beast is in practices, most of the time you have folks coaches are going to have kids in groups, and just remind them that those kids should just stay apart in the groups. And, you know, instead of being right next to the person in front of you to jump in the drill, just spread out a little bit more. No shared water, bring your own. That goes without saying. And then the coaches sanitizing shared equipment before and after each practice and before and after each game. I think that's going to be an important piece. And they should probably just check with maintenance department at your school and say, what do you have that can help me sanitize this equipment? And then we're asking that players bring their own hand sanitizer so that you don't have to share some kind of pump sanitizer and be all touching the same thing. The sunflower seed thing is just about, you know, I'll just give you an overarching concept here. This is about droplets, right? We just don't want droplets in the air having a chance to get to somebody else. So if you're spitting sunflower seeds, or just spitting in general, it's gonna increase that. It's gonna take a while for kids. The sunflower seed part will be easy, but just reminding kids, hey, don't spit, you know, and that, but you know, 14, 15, 16, 17-year-old kids, they spit. You're just gonna have to remind them, kind of remind yourself, guys and gals, that you don't do that while we're at practice or while we're at games.
Okay, so we know that there's a temperature check before practice and games. Coaches, players, whoever you have there should have their temperature checked. It is permissible to take that temperature at home and report it. Remember that 100.4 is considered a fever, in case anybody was wondering. As the Department of Ed nurse said to us, anybody can take a temperature. Of course, you can take it at home or you can develop your own protocol, but it is not required that they take the temperature in front of you. The symptoms that we've outlined, the cough or the fever and everything, everyone should, anybody reporting those symptoms shouldn't be there, okay? And if you have a fever, you need 24 hours fever-free to return if you don't have any other symptoms. Those are pretty standard. We do suggest that you talk to the school nurse or your other medical people if you have players with pre-existing conditions. We know that that's a more vulnerable population, and there may be additional precautions that you need to take for those players. And then you need to track the absences and why people are gone. If they're not showing up, if they're sick or they don't come, follow up to find out why they're not coming to practice.
This next one is one that we got a lot of questions on in regarding to what do we do if we have a positive case, and the answer is you're going to contact local public health. But here's what I'd suggest. I think you do that now. And here's the deal. We can't give one answer to this because there are 99 departments of health in 99 counties. You're going to get different answers depending on where you are based upon the number of cases and the protocol in that county. So I'd get on the phone maybe today and just say, all right, here's the deal. We're starting baseball, softball. If we have a positive case, what are you going to tell us to do so that you're way ahead of the game and you already know what direction you need to go? Because some might just say, well, that kid needs to quarantine, or they might say your team needs to quarantine, or they may say your team needs to quarantine and you need to contact your opponent. We don't know exactly what your county is going to tell you, but I think it'd be best for you to get ahead of it by getting in touch with them as soon as you can. There's a link there, and remember, this is recorded and we're going to get it out to you, so you'll have that link available to you. But there's a link to get to your public health agency if you are not already aware of that. And then the IDPH is still talking through this, and if they give us additional information, we're going to send that out to you as well.
Okay, so now we move to competitions, and we know June 15th is when you can begin play. And I know all of the ADs have been working hard to get their schedule set and when they're going to play and where. You're required to post signage. Again, we've provided a lot of that to you at your playing fields. This is when dugouts become permissible to use, but you still need to social distance, okay? So how are you going to social distance and increase the size of your dugouts so that you can spread your players out? You can do outside the dugout toward the foul pole. Again, we're still using equipment, their own equipment. We're still providing their own water source. No water coolers in the dugouts anymore, their own food. And now coaches are still required to sanitize share equipment. So if your catcher's mask is shared, it needs to be sanitized.
And the same thing for games. Go back one there, Tom. There we go. The same thing on games I'm sorry, there we go. In terms of temperature checks. And again, some people have asked, well, can we check them? Well, if your school's got the equipment to do it, then go ahead. But otherwise, have them, report to you that they had their temperature checked at home. And again, some people would say, well, could they, how do we know they're telling the truth? Well, you don't. Just the same as when you walk into a restaurant, if somebody says, are you not feeling well? You tell them what you want to tell them, and we're just trusting that they'll give us the correct information. Obviously, no one that's displaying symptoms can participate. Limiting the use of bleachers for fans, the common question we're getting is, well, what does that mean? How many? And I think there's two guidelines. Most of the restaurants and other businesses are saying 50%. So maybe there's a guideline for you. The other is from the DE was, families can sit together, but they should spread out from other people. and distance themselves from folks who are not in their families. Fans displaying symptoms, again, are not allowed in. And, you know, the social distancing thing, I think what we've heard from some of you, and rightfully so, is, you know, are we supposed to be the social distancing police? And the answer is, you know, you're the recommender, and you remind people if they need to be reminded. You don't need to have a measuring tape and walk around the bleachers. But I think if somebody were to say, hey, I'm really uncomfortable, this person just won't move away, or every time we move, they get close to us, then I think, you know, you have to address it. And it's the same as, you know, somebody said, well, what are we supposed to do if they won't listen? Same thing you would do if somebody was smoking and you told them to stop smoking and they wouldn't stop, or you told them to stop yelling at the officials and they wouldn't stop, or you told them that they can't bring their dog in and they bring their dog in anyway. You know, what would you do in those situations? You do the same in this situation.
The Department of Education guidelines also allow that you can implement any other measures you think or circumstances that are applicable to your situation regarding social distancing for your staff, students, community members. You can have increased hygiene practices, any other public health measures that you feel you need to implement. You have the freedom to do that. The guidance, there's a link to the guidance there for what they're recommending. So again, you have the flexibility. You can be stricter than what we've said. You know, you still have to do social distancing, but how you do that is up to you. There are no concession stands, especially at school-owned facilities. And then you're required to contact public health if you have a positive case of COVID-19. And we're trying to get more specific guidance on that, but I think Tom covered it earlier. When you know, you make contact with your public health people, you know, when you have symptoms going on, you don't have to wait until you have a positive case and a test reported to contact them for guidance.
Transportation has been a big one, and you know, the DE is very aware of the concern about following correct protocol in transportation. So we're waiting for guidelines. We do think those are going to. We've thought for the past couple of days those would come out. We really do think we're going to get that guidance today, and we'll pass that along to you as soon as possible. In the meantime, you know, just think a little bit ahead of how you're going to make that work, and share ideas with each other. I think that's a good thing. And, you know, already we have some situations in some areas, not all, that say, you know, varsity kids, if we're playing an in-town school, you know, in the bigger areas, urban areas or metro areas, that those kids are already transporting themselves to games. I'm not a big fan of, you know, having kids take themselves, but I think as far as parents go, you know, when I thought about the transportation, the first thing that came to my mind was, when I was an AD, if a bus didn't show up, what was my plan? What was I going to do? And usually we'd say, if parents can drive, we'd like parents to drive. So that may be the case, but just hang on till we hear from the Department of Ed with an official word.
Tom and I had the opportunity to talk with 2 doctors at the Department of Public Health with some of our questions and talking points. And I thought we would just share some of the things that they highlighted on. And actually, Dr. Padati, who is the head of the Department of Public Health, was on our call, and we had a chance to talk to her. And she stressed these things. The virus is transmitted through these droplets, and you need to have prolonged contact closer than 6 feet. So we have time, we have space, we have these droplets going on. And she defined prolonged contact as 30 minutes. So when we think about baseball and softball and we worry about a slide into second base or holding a runner onto first base, think about 30 minutes long as the prolonged contact. And she stressed hand wash, sanitizing, social distancing. Those 3 things are the best way to combat the virus. And a big one that when I think about this for softball and baseball players, you need to try to change the behavior of touching your face as much as possible. And that's going to be hard. She indicated that that's going to be a behavior change. When I think of all the times I sit on a Zoom and I touch my face with my hand to my chin, it's going to be hard for all of us, but we need to change the behaviors. And these were the 3 things that she stressed as the best safety measures to combat the virus.
The next topic is one that we have received a lot of questions on as well, and that is, why are we not requiring face masks? And I think the important thing to remember is that, again, we've gone through with the Department of Public Health on how effective are they. Some people have shown us, professional athletes, maybe even in other countries, that are wearing face masks. Well, I can promise you those are not the same grade of face coverings that our students would be wearing, or our coaches and umpires would be wearing. However, if it's psychologically comforting, then wear it. If it makes somebody feel safer, then go ahead. When we talked to IDPH, they talked a little bit about, it's not as effective as everybody thinks it might be, but it's probably more effective than not having one on. It does encourage touching the face, and as soon as you touch a mask or a face covering, it becomes ineffective. Doesn't work anymore. And if it's not worn properly, same thing. The other thing that Dr. Padati mentioned was, who wants to wear a mask when it's 95 degrees and it's 70% humidity? How long do you think you can have that on? But again, having said that, it may make people feel better to have one on, and I'd say absolutely, go ahead, whether that's a fan or somebody who's participating in the contest.
So as was noted, this is permissive. Whether or not you have a softball or baseball season, or what levels of high school that you play, is up to each district. The key is you need to determine if you can safely conduct the season with the guidelines that you've been given. And it's the responsibility of the home team to have the proper administrative supervision, or a site manager, that's not the head coach, at the contest. So this is an important point. We need to make sure that there is someone there in charge that's not the head coach. I know ADs are not on, all of them are not on 12-month contracts. I know that they have multiple places to be with baseball and softball. We need to have someone on site that's going to be there to help the umpires, whether there's weather and there's an evacuation plan, and we have that coming up as well. So make sure there is this proper administrative supervision. It doesn't have to be an AD, it doesn't have to be a principal. We just need a site manager who's trained and knows what to do at these contests to make sure all of these things are being followed. And again, as we said, you are permitted to have stricter guidelines at your facilities than even these are prescribed. I think I saw yesterday that Des Moines is playing and they're requiring masks for their fans. That is a great example of what a local district can do and decide on their own. We're not requiring face coverings, but if you would like to do that, that's totally up to your district.
This slide, it deals a little bit with eligibility. What if we're not going to play? Just contact our organizations by June 8th, if you would. That helps us with the postseason stuff as we get ready to put those together. And then if a school or a district decides not to play, then what opportunity does the athletes from the school who's not playing, would they have an opportunity to do that, to play somewhere else? We're waiting for some direction from DE on that, but there's really 3 parts to that, right? Part one is the school that canceled the season has to approve the open enrollment out. The receiving school has to approve the open enrollment in, and those deadlines have kind of passed. but people have made exceptions before. And the third is the eligibility rules of the DE. So we're waiting a little bit on that. And again, we hope to have that answer for you today, if not shortly after today.
So we've had questions about physicals and whether students are going to need to get those in the middle and how do they do that. As you know, Governor Reynolds issued an extension to those physicals as part of one of her emergency declaration. That extension applies through June 25th. So after June 25th, you're still allowed the 30-day grace period. That's part of code. So you have 30 days past June 25th for physicals. Now that's probably going to take most of you through baseball and softball season, because by then we're pretty deep into the postseason. But they do suggest that students who physical is expiring to start the scheduling process to avoid any further delays. So you do have that 30-day extension after June 25th. And the protocol for student athletes who fail the first semester class, as you know, on May 6th, Governor Reynolds issued a proclamation and everybody's eligible. That's true for the fall sports. It's true for the summer sports as they begin. The next time you really need to worry about it is first semester or first term grades. Everybody's eligible till the next set of grades come in.
These two have to do with positive cases, and as we said before, you'll go through your local Department of Public Health, and again, we'd encourage you to do that now so that you know what the plan is going to be when you, if you do indeed have a positive case.
So what happens if something happens and you need to cancel the season? Who does that? Well, your local school district can at any time determine that it's no longer safe to hold the season. If there's a lot of COVID cases, then your county or state Department of Health can also cancel the season, the school season. Yeah, they could cancel the whole season. Part of the reason we are just doing baseball and softball is because it allows us to mitigate and manage small numbers of students. And the Department of Health and DE think that's the safest way to kind of return for us. So it could happen. That's why we're going to try to manage it. That's why we have these safety protocols in place. Should the athlete have their temperature taken before each practice and games? And that is true. You should check your temperature before practicing games. It's 104 or above. I've seen a lot of questions about whether you need to record that or keep track of it somehow. And I think just with the social contact and the social tracing and things that's going on, it would behoove you to write to make sure you know what players' temperatures were. So you have a log of it. I don't know that it's particularly hard to create an Excel spreadsheet about what it was. I do have a sample one that we can provide, but I would log in the temperature.
Okay, this next question has to do with are the districts responsible for checking temperatures of spectators? The answer is no. However, if you have the capacity to do it and you want to and you feel better doing it, go ahead. It's kind of, again, it's in some restaurants I've gone to, they've checked before you come in, and others they don't. So it's a case of if you feel like you've got the personnel and the capacity to do it and you want to, then certainly go ahead. How often should players and coaches wash their hands? I think that's some good guidance there. The one thing to keep in mind is, when you're one of the things that we shared with Dr. Padati was, at a baseball or softball practice, if we're running drills and we've got 20, 25 kids out there, we might have 100 balls going. So we're hitting balls, kids are fielding, throwing balls. So lots of people touching lots of baseballs and softballs. So, do we need to clean those after every drill? And her answer was, you're thinking about it the wrong way. Think about it from the other end, that the fear is that they're getting something on their hands. We'll have them clean their hands frequently. So at the end of the drill, go get water and then sanitize your hands and then get back at it. So the more they do that during practice and games, the better.
So what should our practices look like? Well, we know there's no dugouts at practice, and we covered where they're, spread out their equipment and everything. I think the real key part about practices is that the coaches are responsible. This is something that coaches are going to have to do every day to ensure that they're social distancing in their drills, everything their players are doing when they're waiting waiting to bat. All of those have to be spaced out. We can't have congregating of our players, things like that in talking. We did include some of the Sports Medicine Advisory Committee recommendations from the NFHS. Coaches maybe consider breaking up their drills and putting in pods of students with the same students, because if you use the same students in the same drills, they're always working together. That limits some of the exposure. So the key thing about practice is really making sure the coaches understand what the expectation is in regard to hygiene, social distancing, and good practices there. During games for social distancing, where should the additional players go? Well, we need you to expand the dugouts, okay? Some dugouts are very small. They're very tight with the players we have now. So we want you to spread the players out as much as possible, particularly for those players that are actively participating in the games. So think about who you're bringing to the games and who's in the dugouts. We do allow the dugouts to be extended down the foul line. You could place bleachers behind your dugouts for your players or team personnel. But just kind of depending on what your situation is at your facility, think about broadening the area that you consider the dugout.
Speaking of dugouts, who's allowed in there? And dugouts all of a sudden have become sacred space, and I think a lot of you know that, and I mean this in the most respectful way, but some folks who really aren't directly involved in the game feel special if they're in the dugout. It just gives you this feeling that I'm a part of it. So I do the pitch count, or I'm a statistician for you, or I do the official book for you, but I don't coach, and I'm not directly involved with the game. Media folks as well. We're saying only essential personnel, and those are defined as players, coaches, umpires, and trainers. That's it. Nobody else gets in either the established dugout area or the extended dugout area. And then as far as watching practice, we go back to that DE guideline, which they really shouldn't be in the area. Now, if you've got a hill 100 feet from the field, and they sit up on top of the hill and watch it, should you chase them out of there? I don't know that I'd chase them out of there, but if they come down to the fence and they're kind of hanging around the fence, I might say, you probably shouldn't be here. That's the guideline of the DE. A lot of this, now you use signage, you saw the signage we put together, which I hope helps you, but it also might help to get a letter out to your community, get a letter out to your folks ahead of time saying, baseball and softball seasons are now upon us. We ask for your cooperation in these ways. Keep it short, keep it simple, but just tell them we're depending on you, and let them know ahead of time. So, we all think people are paying attention to the news, and we think they're reading everything, but they might not be. And so if the first time they hear that, well, you can't watch practice, is when they come to practice to watch it, that might not go over as well as if they've gotten the information ahead of time. So I just get a little something out to folks and just remind them.
So you are allowed to have spectators at your game if you want. You need to limit where they sit, of course, and practice social distancing. And this is where we ask you to communicate with your people and let them know this is the honor system, and it is their personal responsibility to make sure that they're following that. As Tom said, we don't expect you to go break up fights or be the social distancing police. We expect people to use common sense and to know that if we don't follow these, there's not going to be anybody playing. So I think Iowans have shown their good faith for their kids. And so I hopefully if you communicate to them, your spectators will follow the guidelines you put out. Schools are not permitted to have concession stands in their own school-owned facilities. We do have guidance coming in another slide about state or different facilities that are not owned by the schools, whether city or a stadium owned. Coaches are going to be advised to practice social distancing with umpires as well, or anybody else on the field. You know, so when they have a question about a rule or a call, or they wanted to do a substitution, it's pretty easy to remain socially distant within that 6 feet, the rule, and communicate with the umpires. So coaches will be asked to interact social distancely during the contest on the field.
Limitations on roster, there won't. That's up to you and your squad and your program. So no, we're not asking to limit to a certain number other than, you know, what we would limit for the postseason on a roster. That's about it. Who should be involved with a coach's trip to the mound? I guess the easiest advice would be, you know, try to limit that. Don't bring everybody in there unless, of course, you know, your pitcher, his eyelids are clogged up and he can't breathe through them, and you need to, you know, sacrifice a live chicken to get the curse off your first baseman's glove, and you have to decide what you're going to get an assistant coach for a wedding gift. I'm not sure all those people need to be at the mound. You probably, and again, just, you know, talk to your coaches about, and we'll be talking to coaches as well. Just try to you know, tell your players ahead of time, when I come out to the mound, here's who I want there. Unless I call you over, just stay where you are, and we'll get it figured out.
So the pregame meeting and home plate, again, social distancing. One coach in softball is the head coach, 2 to 3 umpires who are there. No players. The players should stay in their dugout. You can exchange lineup cards, normal lineup cards exchange. And of course, as we've been started to think about all the social distancing, we know that team handshakes probably are forever in the past of most of our contests. So we don't want handshaking. Maybe come up with a different way to acknowledge the other team, tip of the hat, or something that doesn't involve contact. So there's a lot, I think, of different ways we're going to need to exchange, to look at things, not just the post-game or pre-game handshake, the national anthem, the lineup for starting, you know, the lineup for the anthem, and the starting lineups. You know, no coming out of the dugout after a home run and piling on top of everybody. We still want to have fun, and we're just going to have to think of alternate ways for our teams to practice social distancing during the game.
Yeah, no handshakes, and then be careful of those hand gestures after the game. That's the one thing you want to be aware of. So maximum capacity, again, that's going to be local, because we don't know what your facilities are like. Some you know, the bleachers are so large that you may have a chance to spread out, and in others, you know, front to back and side to side, it might be so small that, but again, you know, I'll go back to most restaurants and businesses where people congregate are saying 50% capacity. And that might not be a bad guideline if you're worried about how many people are coming in. I would say the biggest thing I'd be looking at as an AD is students. You know, our students have been clamoring for a chance to get together and hang out. Not that they haven't already been doing that in other places, but for a school event, when that first game happens, you may see a flood of your students come in to watch that game. Call the leaders in, you know who those kids are. Just call a few of them in and say, hey, you got to help me out here. You know, when you guys come in, I can't have you all in a big group. Can you help me with spreading kids out and spreading your classmates out? I think, again, if you get ahead of it before they show up that night, you got a little better chance to have them do what you want them to do. Personnel in the press box, second to the dugout. That's the place people feel special if they get to go. So again, just establish beforehand, this is who gets to go in there. Let them know long before the game comes around that that's the way it's going to be.
So are masks required? No, masks are not required for players, coaches, umpires by us, but certainly within your district, you are, you can have that as a stricter requirement. It is recommended only that if they're worn, that's a solid color. It doesn't have to be, that's a recommendation. We would suggest that pitchers in softball avoid the optic yellow color if at all possible. So there's no requirements on size, look, shape, any of that. But if you're going to wear them and you have the chance to do a solid color, it would be great. Who's responsible for the hand sanitizer and the wipes? The guidelines from the Department of Ed say players are encouraged to bring their own. Certainly, schools can provide it, put some in the dugout, provide it on the trip, but I think the reasoning behind it is they should get used to carrying their own so they can use it when, on the bus or wherever they can get used to sanitizing. So you're not required to give it. They're responsible, but you can work that out as well for your own local policies.
As far as face shields go, you saw the guidance from the NFHS. We're going to follow that where we don't allow the face shields. Those create more of a danger for somebody else if there's a collision or someone else comes in contact with it. So those are not allowed. Does each player need their own batting helmet? That'd be optimal, wouldn't it? If there's a way to do it. Might be and it may not work in your district, but again, as I was thinking about this as my days as an AD, I thought this would be a great ask for the booster club. Can we get enough helmets so that each kid can have his own during that contest, and then we'll keep them for the future. We'll have them there, but in some cases, again, that may not be feasible, but if you can do it, that'd be great. Do they need their own bat? Again, I think as much as possible, that'd be a good thing. We know that they share, just wipe them down in between uses and make sure kids, before they pick up a bat, sanitize their hands, and then when they're done, they're at bat, they come back to the dugout, sanitize their hands again.
So all of the guidance on equipment, whether you need it or share it, is the same. You don't need your own, but if you share it, it has to, we'd prefer that they didn't share it, but if they share it, you need to sanitize it. How often? Shared equipment is after each practice and games. How often do you sanitize the bat? Before and after each practice and games. I think, if in doubt, just sanitize. And the point Tom made and Dr. Padati made, it is more about the hands than the equipment. Wash the hands that have touched the bat, touched the ball, and take care of your equipment. But, it's pretty easy to wipe off the bat handle. A little harder for the catching equipment, but sanitize if it's being shared.
Okay. Same thing with the other equipment, same guidelines, and then down at the bottom, that third question, how should people hand sanitize? There's a little guidance there as well, and the big thing again, besides sanitizing your hands, is just try not to touch the face. Try to be aware of that.
Water cups available. Each player should have their own water source, okay? No hoses, no water coolers. We don't want any sharing of the beverages they're drinking. So it does need to be individual to the players and coaches, anybody who's there. So think about how the water bottle situation is going to be handled because we know summers get hot and they need to hydrate. Your maintenance equipment, daily sanitation would be recommended. How many people in your restrooms, that's based on the size of your facility, and you know, how many people can be in and out. So local policy would determine your procedures there on your restrooms.
How often should dugouts be cleaned? Same deal. You know, I think, you know, before a game, after a game, and again, your maintenance folks will know the best way to do that. So I would defer to them. As far as admission goes, you know, follow similar guidelines. What we're saying is just follow similar guidelines to retail store clerks. You know, wear a mask. If they want to wear gloves, they can wear gloves. Maybe stand behind a shield of some sort. That'd be probably the best way to go. Someone had asked us, well, you know, could the associations just require online ticketing? But there still has to be somebody there to check it, right? You still have to check the phone or scan it. So you're going to be coming in contact with someone one way or another.
So for your facilities, is your weight room allowed to be open for your practice for softball and baseball? And no, weight rooms are closed, okay? They're not available yet for any student athletes to use, but you can take out the equipment you need for the baseball and softball players so they have it and it's accessible to them. Can we use the gym for practice if it rains? Yes, and you can use an indoor facility, but remember, there are guidelines from the Department of Ed. You still have to follow social distancing, you still have to follow capacity, you still have to follow the hygiene. It's not just as easy as you move it in from outside to the gym. So I would check the Department of Ed guidelines that they've issued about reopening of your facilities. Because you need to have your school needs to have a policy on the use of that facility before you move in, and then you're required to know what the policy is about cleaning it, supervising its limits, sanitizing everything. So you have to be consistent with the use of that indoor facility if you're going to move it in.
Can a football field like field turf be used? Yes. Yeah. So, and not just when it rains. I mean, if you feel like that's the place, maybe your varsity's practicing on the baseball field and the sophomores are warming up over on the turf, sure. You know, they could do that. It doesn't have to just be during inclement weather. Protocol in case of inclement weather, you can move people into the gym, you can move them into the facility. I would, again, you know, think about what is the imminent danger. You know, if the imminent danger is a tornado or a severe thunderstorm, you want to get people to safety now because that is your number one priority. And maybe they have to go down the halls, maybe to spread out enough. But again, you know, we're all supposed to have our emergency plans in place. This is just another example of an emergency plan that has to be adapted. And so, you know, the sooner you can get on that and communicate it out, the better. Can concessions be sold if the facility is city or county owned? The answer is yes, as long as they are a licensed establishment, licensed food establishment, and they have inspections and they comply with the reopening guidelines for restaurants. If they meet all of those criteria, then yes. So if they're, you know, example would be Riverfront Stadium in the Quad City area, Principal Park, yes, as long as they are licensed and they get inspected, then they can't. Some have said, well, my booster club stand in my school is licensed and inspected. And the answer is, until we hear different from the DE, school concession stands are closed. Concession stands on school facilities are closed.
Some information about umpires. If umpires have registered and decide they don't want to umpire this season, and some will, you know, we have some of our veteran officials in softball and baseball, and they may have underlying health, and they may decide personally that they just do not want to do it this season, and we're going to issue refunds. So baseball can contact Laura, and softball can contact Sherry.
This has to deal with coach contact before June 1st. That's not allowed, but virtual is. So, you know, and again, the people have asked, well, why? What's the difference if I do a virtual one and I tell my pitcher what to do during that virtual workout? Why can't I just be there? And the answer is contact. You know, we just don't want in-person, face-to-face contact until that June 1st date. It gives us 2 more weeks. You know, from the time the governor made the announcement, it gave us a couple more weeks to let the virus numbers come down even further and slow the spread. So that was the reason for it. But, you know, my guess is as soon as that announcement came out, kids grabbed their gloves and balls and went outside and got after it. And then anything you've sent them, hopefully they've been doing as well. No adaptations to the pitch count rule. We just assume that people are going to, you know, be responsible when it comes to how many early in the season, especially about how many pitches kids are throwing. So there will not be changes there. And the postseason schedule, you've seen those come out, and you know, the girls are going to move things up a little bit, and the baseball dates are going to stay the same.
So how do you create a schedule? I think a lot of conferences have already been on this, probably started in the spring when we suspended spring sports. So you've given some thought to this, but schools are free to set their schedule with the beginning date of June 15th. We are not changing any game limitations or individual or team. Those remain the same. What happens if you have a school that you don't want to play, or both somebody doesn't want to play because of the result of a COVID test? Well, if the Department of Public Health advises either school that you shouldn't be played, it's a no contest. If the school says we're just not going to play, we're worried, it's your area, you have high positive tests, it's a forfeit. So it kind of depends on what the reason is for not playing related to COVID.
This question, I think the most questions we're getting in regard to this particular topic have to do with junior high. Why were junior high teams not allowed to participate? And again, it goes back to, you know, opening slowly, phasing back in. And if we just have baseball and softball at the high school level, we can monitor that pretty easily. And the Department of Ed can monitor that very easily, and the IDPH. If we start adding groups, then it gets tougher to monitor and say just where did the problems happen. You know, if things tick up, then it could be a lot of different places. It's the same rationale as why are we not allowing out of season contact until July 1st. It's because if we start to get 60,000 kids engaged in things instead of, you know, 15 to 20,000, then we've got a lot of variables. So they wanted to limit the number of variables, and that's why junior high. Now we realize that kind of left the 7th graders hanging out there, because the 8th graders can practice and play with the varsity teams. Those 7th graders, if you've got a community that you're lucky enough to have youth programs, little leagues and things like that, they can certainly participate in those. And your coaches are certainly allowed to coach those non-school teams in the community if they want to. The next question had to do with inter-squad scrimmages. An inter-squad scrimmage is considered a practice. So yes, you could do that, but you couldn't have fans there. You know, you can't have a Gatorade night or a soap night or anything like that. It's just what it is. It's a practice, and you run it like a game, but there are no fans there as well. Once June 15th gets there, then you could scrimmage other schools if you want to. If you're having trouble filling your schedule and you thought, I'd sure like another game before we get to the tournament, then do a scrimmage with another school, and then you could have fans there if that's the case. All right, so that's what we wanted to go through. Gary, Todd, Jared, are there questions that have not been answered yet that you have not been able to answer that we might want to hear?
There are lots of questions there. So some of them have been answered. We're kind of just sorting through those yet.
So should we start at the top of the open ones, maybe? Jeff asked about local health departments giving guidance to teams that might have a case of COVID, how we guarantee what is consistent throughout the state for the safety for all of our teams. Well, the word guarantee probably is not in the vocabulary during COVID, Jeff, sorry. I think the guidance has been that local health departments are responding to what's in their local area. So it might be different depending on the county. If that gets to what you're answering, I think you're getting at it, is it gonna be safe for our teams to travel to another county when they have positive cases of COVID? How do we know it's being managed to the safety? And we've been advised that the local health department is your resource. But certainly if you have concerns, I would call ahead and talk to the AD and see how they're handling it in their community with their team. And that might give you some idea of what's being done locally to the places you're going.
Gene, if you'd like, I believe Jeff has some clarification on that question. I can allow him to speak if that's okay.
Okay, sure.
All right, one moment here, Jeff. All right, Jeff, you're on. Looks like Jeff is still on mute, unfortunately.
Okay. Well,
No,
maybe-
we're trying to come back to you.
Oh.
Oh, there's Jeff. All right, here's Jeff.
Sorry about that. That's exactly it. And I mean, a perfect example is, I think in your presentation, you said at the state level, they're saying a prolonged time 6 feet apart is 30 minutes. When we talked to our health department yesterday, trying to get out ahead of this, he said it was 10 minutes. So the advice he gave us that, you know, if you're in a dugout batting and then the next day you have a COVID case and they're together for 10 minutes in a dugout, he's going to quarantine our whole team, is kind of what he was hinting at. So my question is there going to be any consistency? What you're basically saying, there might not be, and that we should just call ahead. I just see that as a potential problem if there's not some consistency between some local health departments.
Yeah.
That was just.
Yeah, okay.
And Jeff, I think when we hear things like that, thank you for that question, and thanks for sharing your conversation with your county public health. We'll share that with Dr. Lebo and Dr. Padati and let them know there's some inconsistency and see if they can't, you know, maybe share out some guidance to all the county health departments to help you guys with that.
And that's all I mean, that's it. And I get it. You know, not everything's going to be perfect. And I think that's good advice. Call ahead. You know, if I'm going to Sioux City or if I'm going to Harlan, like the paper asked me yesterday, I'm just going to call those ADs and say, hey, you know, if we have a kid that might come down with it, here's what we're going to be thinking about. And then they can go vice versa. The good news from our local officials says that if you're not together more than 10 minutes, which does not happen very much in a baseball and softball game, having it given it to another opposing team is very minimal. So that is the good news.
Right. And that's again good to know. And I think, you know, like a lot of things in COVID, the guidance that we're getting, depending on who we are and where we seek it, depends on the research the advisor is giving us, right? So yeah. Where are they getting the research? And maybe it is varying from county to county, and we just need to get IDPH involved and trying to get some consistency for you. We'll do that.
Okay. Thank you.
Yep.
So we have questions about recording the daily temperature, the exact record of it, or just over, under, record. I would record it, I guess, you know, make sure so you know you're doing and what it was. Can you require masks for catcher, first base, runners, umpires? Yes, you're free to do locally what you think is best for safely having the thing. Can student athletes use different colored helmets? In softball, that is permissible. The batting helmets do not have to match. I'm not a baseball. Jared or Todd? Baseball helmets have to match colors?
They do not.
Fans displaying symptoms are not allowed. Who polices that? Is that a suggestion or a rule? Well, I think that has been talked about a lot just in society. If you're sick, you're supposed to stay home. So it is not something that we expect you to police. We call that social responsibility, and making sure you communicate that ahead to your fans, your parents, people who are coming to your event, that if they believe they are sick, or maybe if they have underlying health conditions, they should not be there. But of course, you can take everybody's temperature coming in if you feel you'd like to do that as well. Signage preferred over a letter to the parents to sign. What about legality? I'd check with your local general counsel on the forms you want, permission slips, all of that. I think anytime you want to communicate with people, you need to over communicate. Signs in a letter, social media, anything that you can do to get out to your parents, players, and your patrons, you should do.
Gene, can I go back to a question on masks?
Sure.
I think the one thing to remember is if you choose for your team to wear masks, or certain members of the team, you can certainly do that. What you're not able to do is require your opponent to wear masks. So if you're worried that, and if your school district says we will only play teams that wear masks, then that's something you're going to have to work through. But there may be kids on your team that are more vulnerable because of a condition that he or she might have, and you feel better if everybody around them's wearing masks. Well, you have control of that with your team, but you don't have control of that with another team. So again, I'd reach out to, if I had a player that was vulnerable and I would like the opponents to do that, I think I'd have to reach out and say, can you help us with this? And if they say, no, we're not going to wear them, then you have the right to say, you know what, then we're not going to play.
The list of registered officials, baseball or softball, I'm not sure. Possible to get a list of the registered officials and contact information, wrestling and basketball, that's probably, but yeah, if you want it, the Girls Union can supply that if you'd like, just email us. And I'll let Jared maybe on the baseball.
I was unaware we did that for the winter sports, but we can do the same for the summer.
So if you're having trouble getting supplies of things, getting thermometers or your hand sanitizers and masks, it's not paying for it, but much of it is on back order. The DE does have a couple of supply lines. I have a supplier of sanitizer who has reached out. I would check with other ADs and see if they have supply chain. Does anybody else have any advice on the supply of the stuff and back order? School district supply person? All those? Hospitals don't allow their own employees to take their own temps, so why would we think it would be okay for baseball, softball? Well, because the Department of Public Health said it would be okay, I guess. And with the digital thermometers and stuff, it's not hard to take a temp. Again, and this is a measure to stay on top of it, to be preventative. I think people who work in hospitals are around it a lot differently and have different standards. So again, we're trying to have students track their temps as preventative, as getting in front. of it. So anybody else want to add anything about the taking? Who's responsible to contact public health? I think it's your responsibility. That's what the guidance says. If you know there's a positive test, you need to talk to public health because you need to get guidance on what you're supposed to do because what they've been around your team and your personnel.
And Jean, that's similar to, you know, if a kid was in school, it's still the school's responsibility to contact county health.
If a student comes in contact with a person who tests positive, are they out for 14 days? Kid out to, don't know. I think that's why you visit with your Department of Public Health. The way it was explained to Tom and I when we were on with Dr. Padati is they're going to ask questions. How long were you in contact? Where else were you? Where, you know, they're going to try to determine where and how. Each case is a little bit different. And I think that's why we're not saying absolutely they'll be quarantined. Absolutely they'll be, you know, you'll have to stop playing. So contact your Department of Public Health there. Your physicals, let's see, I lost it. Went down, where am I at here?
There you go. If there's no physical on file and the athlete hasn't participated in other activities this year, do they still have the same participation waiver as others that have expired physical? The answer is yes. Once you get, you know, once that proclamation is over, you know, if your physical expired prior to the proclamation ending, you have 30 more days. If you still have some time left on your physical, you have whatever that is plus 30 days.
Is there any information that can be shared ahead of time with fans? All of that information is on the Iowa COVID website, the CDC website. There's lots. It's all on the signs that, besides the sign, the information that's available can be sent in a different form. So it's out there, readily available. It's the gathering of it. Do outside freestanding pop and Gatorade machines need to be removed?
I'd turn them off.
I'd turn them off, yeah. Question and answers available at the end of the webinar?
Yep.
Yes.
And can I interject here, Jean? To respect everybody's time, you know, we did say we would limit this to 90 minutes. We're not quite there yet. But if we get to 90 minutes and we haven't answered everything, we are going to go ahead and answer these questions, and we'll post it with the webinar so that you can go back in. If your question didn't get answered right away in the 90 minutes, we'll still do that. Okay.
Have to police your fans if you're not social distancing. Why wouldn't we be policing social distancing to police ourselves, to protect ourselves? Well, again, I think the expectation is, we don't expect you to be confrontational or to go and make them move. I think the idea is you communicate the expectations and try to get them to follow them. But we don't want anybody in any danger or placing themselves in any harm's way. Tom, do you have any thoughts about that? You probably encountered more rough people in your days than me.
And again, I think if somebody was at your event and they were endangering somebody else, whether that was smoking or, getting verbally abusive with somebody, what would you do? And again, I think it's getting ahead of it with communication to your community will help a lot. And having a conversation with those folks during the game, they're not fun conversations, but I think if you just appeal to their their good nature and do it as a suggestion or a request, you're better off. Now, you know, depending on where you're at and what you do, I mean, I've had to say over the years when somebody says, well, what are you going to do about it? My answer is, well, I guess Officer Friendly is going to come over and escort you out. But, you know, you don't want to get to that point, but, you know, that's ultimately where it gets to is you'll go out and you won't be allowed to come back to any games the rest of the year if you can't just abide by what we're asking on this. So I'm not foolish enough and naive enough to think that you're not going to run into some of that. But I would hope that people are understanding, and I'm going to guess you're going to get a little support from some of the other fans who are there as well.
A food truck parked not on school property across from the field. Your thoughts on that? Anybody?
That's not your area. Don't worry about it.
Yep. Players bringing their own food, is it permissible for the school to pack bags for them to eat after the game? So this is how you've been doing meals for your students the last few months. Zach, maybe we should ask, I don't know, Tom, how do you feel about that?
I mean, I think the nutrition department is inspected, and if they're following, you know, safety guidelines, and you know, you can be sure that one student will be handed one bag and kids aren't, you know, putting their hands on several bags, then I guess, you know, if you've got protocol in place, you can probably do that. Yeah,
it's just the sharing of food and, you know, the touching of other people's things they're going to be putting in their mouth. That's what the concern is. Concession stand, baseball and softball teams, city-owned fields, city hires Hy-Vee. So Hy-Vee is the vendor there. Baseball boosters run it. Yeah, I would, since your baseball boosters are not like a restaurant and haven't been inspected or licensed. Tom, how about you?
Yeah, I'd say the Hy-Vee thing, yes, because they're gonna be licensed, but the other, I'd say no.
Yeah. Can players have hand sanitizer on their person in their pocket? Jared, any NFHS rules? I don't know of any.
Can only come down to hard and unyielding items.
Yep. Probably not the same pocket as the tobacco, right, Jared?
And the seeds.
If a player shows up to practice one day, no fever, and the next day they have a fever of 102, should we shut down practices? Well, the fever should be taken before practice, before they get there, or isolated somewhere. So if they've taken it at home or at the field and it displays, they should be sent home. They should be sent home just like you would send a sick kid home for school. Tom, anything on that to add?
No.
Okay. No junior high doesn't make any sense. Why are we leaving out? Why are we leaving out one grade level to participate? Well, let's go back to when the governor allowed us to have it. We decided because the reason for allowing us was sort of just putting our toe in the water a little bit. And we wanted to be able to control with numbers and mitigate and manage the virus in a responsible way, because this is a plan for later on, for down the fall, for how we're going to do things. And so when you think about it, it's numbers, okay? And then when she opened up youth sports just recently, we talked about it again. And we decided that the original rationale hadn't changed. We were still trying to control numbers with mitigation and management. So remember now, then we've been hearing from all of you of all of your questions about this responsibilities and the details. And now adding more to that for junior high didn't seem prudent to us. I think that we want to make sure that what we're doing very well, and we're making sure that we can be responsible for their safety. And so the decision was made to stay and not allow junior high. You know, I think our junior high coaches typically have less experience, and there's been a lot of responsibility placed on some of our coaches. And so for all those reasons, we decided to stay with our original plan of high school sports, because adding more people to it seemed to go against the original reason for allowing us back to play. Middle school off-season coaching.
If you'd like, Gene, I can ask Dustin to clarify that.
Yeah.
All right, Dustin, I'm going to give you the opportunity to talk here in just a moment. You'll have to unmute yourself. Go ahead and unmute yourself and clarify that question.
Yeah, I think I think Gary answered that high school and middle school are the same. I just had some middle school coaches asking if they were to follow the same rules. I've got a cross-country coach who's interested in giving some summer guidance. Sounds like that can be done virtually during June, and then in July they could have their fun runs again. It would follow the same as the high school. I just wanted to make sure that the off season was the same as the middle school to the high school. That makes sense.
Yep.
Okay, Mark has a comment about what he's learned from Washington County Public Health. Should you require a waiver to participate? Or you covered? That's a local general counsel discussion, Randy. We know that there are waivers out there that I think the school administrators of Iowa provided one, but that is local, and talk to your general counsel. 10 minutes contact rule for tracking, but would not quarantine everyone. There's Page County. If the catcher or parent does not feel comfortable with the umpire home plate, what's the best solution? Well, we talked about moving the umpire, but we felt, and I'll speak for softball and baseball can weigh in, that it just changed the integrity of the game too much. That's where the umpire needs to be to call the game. I think that each individual player and their parent have a responsibility to make the decision that's best for them. So the umpires are going to stay behind the catchers. They can move back a little bit. But if your catcher or parent doesn't feel comfortable, maybe talk to them and see what would make them more comfortable. But again, we're not requiring masks for umpires. Jared, do you have anything about the umpire behind home plate?
Now, we met with our umpiring group, and we'll share the same message that on Monday night with them. We are strongly discouraging the use of an umpire calling balls and strikes from behind the mound. At the lower level games, it's truly an expectation that the umpire for a varsity contest will be behind the plate.
Local businesses selling food in the parking lot. I think the parking lot is on your property. So probably not, right? It's on your property.
Right.
Mr. Keating?
I'd agree.
Yeah. Allowances for umpires not calling, move the pitcher's mound? No. Umpires will be behind the plate at the varsity level.
And can I weigh in on that just a little bit? You know, part of it is, now you got a runner on first. Now you have two umpires in the same area. Things get congested. The obvious, you're now, either 40 to 60 feet away. So how do we tell a parent, stop yelling about balls and strikes? You're not there. You're not close enough. Well, now he's 60 feet away calling balls and strikes. So, I'm not so, and during the contest, in between batters, certainly, and sometimes even in between pitches, an umpire can step back. They don't have to remain right next to the catcher. They can step back for, a period of time, then step back in. So we think the separation is good enough that we can keep them there.
Good ad. That's a good ad, Mr. Keating. We will have a transcript of the question and A. We'll send it out. Signage. Well, Mr. Garvis, is like right after this meeting too soon for you for the signage on our website? So what?
If it's not soon enough, Jason Esslinger has just posted the link in the chat.
Okay.
Contact public health. You're in 3 counties. Which county? Well, which public health do you do for school normally with your school nurse? Like when you have a flu outbreak and you have to report the absences, what county health department are you using for that? If you need more, I'm not sure who this is, school user, but if you want to contact us, we can put you in touch. But I would use the Department of Public Health that you use normally for your school stuff. Tom, do you have any?
No, I think I give the same advice.
Athletic trainers, the information for athletic trainers is coming. We've reached out to the Iowa athletic trainers, to the athletic training program at Drake, and we're using some of the NFHS sports medicine contacts, so we will have athletic training information coming out. The physical rules, 2 messages. So June 25th, let's see if we can clear it up. June 25th is when you are permitted to now by the proclamation. So everybody's good through June 25th plus 30 days. Hope that cleared it up. But if not, get a hold of us and we'll talk it through. Transportation info, yes, we will push it out to you, Jerry, as soon as we get it. Can a booster club run a concession stand at a community field? Well, it has to be licensed and inspected and like a restaurant. So I don't know if it meets those requirements or not. The city rec field is located on school property. They are allowed to start their rec program and we can have 7th players play in the read and coached by our junior high coaches. Yes, you can have your 7th graders coached by your junior high coaches play on your non-school teams. That is correct. Well, the problem with filling up their water bottle during practice or games with a water fountain or hose is that there will be multiple people touching that fountain and hose. And so specifically water fountains are out and hoses are out. So you have to figure out a way to prevent multiple touches of the water going into those water bottles.
I think Aaron's question is in regard to temperature checks. And I would say that if the kid reports or you take the temperature and they're over, you record that. You know, this kid reported the temperature, you know, and it could be, they may not know exactly what it was. So just note that a kid was sent home because it was reported, he or she reported having a temperature. And for the rest of the kids, I don't think you need to say, Johnny didn't have a temperature, Billy didn't have a temperature, Mary didn't have a temperature. But those who do, note them. If you know what the temperature was, record it. If you don't, just record that they reported having a temperature. I hope that helps, Aaron. If it doesn't, Tom, can you let Aaron maybe clarify his question for us?
Yep, Aaron, I'm going to allow you to talk. Go ahead and unmute yourself and clarify your question.
All right. Yes, Tom, it does. A question came up in a chat group we have here because I'd like to think all of our kids are going to take their temperatures at home before they come. But if they don't, and we're taking temperature, and this kid has not had a temperature before, now all of a sudden today, on June 21st, they have a fever of 102. Should we shut down because they could have been asymptomatic COVID for the past 3-4 days and been spreading that amongst our kids? So should we shut down until the health department does what they need to do to say, yes, you can resume, or do we keep going? That was the question.
Yep, I think I'd keep going, but I would call the health department and say, here's what we've run into and we're letting them, we're still practicing. Do we need to shut down? I think that's what I would do. With one kid, I wouldn't let one kid with a temperature shut it down. Other things can cause a temperature. I hope that helps.
Thank you.
Yep.
The links to the coaches Zoom tomorrow, so your coaches have it. Yep, we can send that out. You want to all AD?
Yeah, those will be going out.
Yep. PA
I can-
scripts.
Gene,
Yep.
if I can interrupt,
Yeah.
I mean, I did send an email to all of the ADs and to the baseball coaches. So baseball coaches should have all the information for that tomorrow. So Bo or ADs, you can forward the email that was sent to you to your coach, because that link was there as well. But I can certainly send it out again as well too. But everything for ADs and baseball coaches was sent by the Athletic Association office for our baseball coaches.
Script for PA announcers. Yes, we're working on that. That will be similar to the signs. And we'll have it posted before the first games that you can pull off of our website. If our outdoor facility is rented and students pay for a non-sport specific training program, when can that start?
With your coaches, it can start July 1st.
And on your school facilities on July 1st.
Right.
Should teams pitch their own baseball, softballs during the game? Who gets the foul balls when hit? Yeah, softball, we'll be going over that. The home team will supply the game balls and split them up. Each team will have their own supply, and the defensive team will play with the balls, and the balls will come in from the dugout. For foul balls, you know, when those come in, we'll need to sanitize them before they're put in play. So you need to plan for that. Anything, Jared, on baseball along those?
Well, the same protocol as softball, but we also need to be aware for both baseball and softball. If a pitcher goes to licks their fingers prior to being on the plate, the umpire is going to have to kill the ball. And at that point, the ball is dead and we'll have to get a new ball in play. And based on an email that Todd received late Monday from the chair of the NFHS Sports Medicine Committee, that ball will need to be sanitized due to the saliva on the ball prior to coming back into play.
And we'll have those written out and shared as well for umpires and coaches. Professional team photos allowed to be taken since social distance. You mean with the team, the social distancing wouldn't be taking place? Is this the team photo? I had one suggestion that you take them. You take each kid's picture and Photoshop it together. Anybody want to weigh in on team pictures?
We'll seek guidance on that one and get back to them.
Yeah.
I mean, I think if we're expecting social distancing, that's impossible to do that. I guess that might be something you wait and see. Things might be different in 6 weeks from now and be able to do a team photo at that point. But I don't think it's something that would be recommended at this time.
Are locker rooms allowed to be accessed by players if they are in an indoor practice facility? Same for if we have a locker room attached to a dugout.
I would say no. I would say no.
You have a whole different set of protocols about social distancing and cleaning and supervision and all of that. Jared, happens if a pitcher licks his fingers, blow in their hands.
At that point, the ball umpire, once it's noticed by the umpire, either umpire can kill the ball at that point and require a new baseball to come back into play. And again, ball will need to be, that ball that's thrown out will need to be sanitized quickly before it's allowed back into play.
Repeat the return to play guidelines for players who have a temp of 100.4 or above. Was this maybe some of the stuff that Tom talked about that Aaron had a question about, or?
I think we said it's similar to a student at school who should not return until they're fever-free for 24 hours. So they need to be below 100.4 for 24 hours before they could come back.
If a pitcher licks or blows in their hand, the ball is sanitized, but will the pitcher have to sanitize before getting the new ball?
That's a great question.
Very good question, Josh. How about we check and get back?
Yep.
Guidance on restrooms. Closed, how often do they need to be sanitized? That depends on size and how many and local. So check maybe on what some of the local guidance is on other facilities with restrooms and you know, how many people you let in.
Okay.
Do we have any more?
I think that was, we're getting close to the end now.
Yep.
You know, you can certainly send either of our organizations additional questions as you process through things. What we're trying to do is a balance here, I think, everybody, that, you know, we want to try to keep things as simple as we can. We want to try not to overreact to things, but we also want to ensure safety for people. So somewhere, you know, there's nirvana there. I'm not sure where, but we get to that perfect or that sweet spot, and that's our goal. We are going to learn a lot of things through the season. Things are going to come up that we're going to have to seek answers to. But as I told our group the other day, once the practices get going, things will settle down a little bit, and the really essential questions, I think, are going to come up. You know, the things that really matter, we're going to hear it. So please feel free to reach out with anything you have. And we'll do our best to get the guidance for you. We will be sending out the guidance from the DE on transportation as soon as we get it, as well as the open enrollment eligibility.
I think a couple things to add is I know there's been some questions just regarding non-softball, non-baseball Q&A. We're still waiting for guidance from the Department of Education on a lot of that. Obviously, with June 1, you have questions related to that. Hopefully we'll get it sooner than later. And the other little thing is with a lot of us responding, I mean, we got multiple people responding. If we're coming up with different responses, please let us know so we can talk internally and make sure that we're in agreement. I think a sense I have is we really have been pretty much all the same, but if there are a couple that have different answers, you know, please let us know so we can make sure we get everybody the right answer.
Right. And the last thing that I'll share is the word that has not been real popular during this whole thing for any of us included, is patience. And, you know, that's why our out of season coaches, you know, they want to get going. They want to work with their teams. And so they're going to keep pressing for this. But if we can keep reminding everybody that trying to limit the contact is the goal here. We need to learn what this thing can do. You know, what having two sports going, what that's going to do to the numbers, if anything. Because if we're gonna head into the fall, we better know what we're looking at and what we need to get ready for. And I think this is going to help us. So thanks so much for your questions, and thanks for reaching out to us. You guys are in the trenches, you're living it. So you know, we'll find out whatever we can for you and help. But man, without you, we don't even know what we're facing. So thanks again. We really appreciate it.
Thank you.
Yep.
Stay safe.
Thank you all for attending. I'd like to thank our panelists, Gene Berger, Tom Keating, Todd Tharp, Gary Ross, and Jared Chizik. Following this meeting, I will be downloading this recording, and you will all receive the link to the recording following later today, in addition to the links for the posters. And as we put together the public service announcements, we'll share those as well. We'll also be putting together the transcript with all these question and answers that have come through, and we'll share that once it's formatted properly. Again, thank you for all that you do to serve our student athletes, our coaches, and our communities. We're all in this together, and we look forward to putting together a great season this summer. Thank you. Take care.